I'm Dr. Chuck Murphy. I'm at the Patient Safety Movement Mid-Year Meeting, which is being hosted at the Inova Center for Personalized Health. This afternoon, we're very fortunate to be joined by Deb Pasko, who is the Director of Medication Safety and Quality at ASHP. Deb, you guys do some great work around medication safety. Tell me some of your recent work.
So thank you, Dr. Murphy. We have several efforts around medication safety, and it's within our Office of Practice Advancement at ASHP. We do work in the national stage with players such as the CDC, CMS, FDA, NIH. And we focus on some of the national AD action plans around anticoagulants, hypoglycemia, opioids, but we also have a special project that's called Standardize for Safety. And that's through the FDA. It's funded through them, that's through their Safe Use Initiative.
So there's some very famous, I think, events that have occurred because of the lack of standardization of medications.
Yes. Unfortunately, I don't think people understand sometimes of the lack of standardization, how that really relates to their care. And we know that every day we transport patients within our hospital systems, even across town, even across states. And they receive medications through IVs or even oral liquid compounded medications that one institution may use a different concentration than another institution. And when that happens, it unfortunately sets us up to make an error if we have improper med rec when those patients are transferred.
And of course, for high reliability organizations, having standardization and reliability is sort of part of getting to that very safe level.
Absolutely. We very much value high reliability and think that that's very important within institutions. We're using standardization essentially as an error prevention tool. And in doing that, really ensuring that we are providing the safest care for our patients. In the scenario that I provided for you, that some patients, when they transfer, this may even be within the same system that uses a different concentration of IV medication between the emergency department, the operating room, and the intensive care unit. So each time we choose a different concentration, the pharmacy might be compounding something, or the nurse administering or touching a pump, which we may make an error in all of those steps.
Wow. So, and of course, when I look at the data, usually medication errors tends to be number one in terms of overall numbers of errors in healthcare.
Yes, it is still our number one problem, and medications are quite complex these days. There's more and more that come out on the market every single day, but there's also ones that we've used for years that we still seem to be having issues with. And a good example of that is heparin. So an anticoagulant blood thinner that we've used literally for years, but we've still seen compounding errors with heparin. We've also seen administration errors that have caused temporary harm, permanent harm, or even in some cases death.
And it still seems like packaging is a bit of a issue related to medication safety.
Packaging really is an issue. Some of the errors that we've seen with heparin, for example, people have seen on a vial, and instead of reading that it was 1,000 units per ml, thought the whole vial was 1,000 units. And it's really, the labeling is quite critical for healthcare staff to be reading the label, but then also for manufacturers to use bolding or tall man lettering, colors, etc., to really kind of differentiate what those concentrations are.
Now, for patients and families, I think that you guys have a website and such that I believe has information for patients and families about medication safety?
We do. So we do have a consumer website. It's safemedication.com, where patients can go and see that information. We also just had a new release we submitted 5 recommendations to a campaign called Choosing Wisely. And the last recommendation is very consumer focused, and Consumer Reports did a patient leaflet about using ml dosing only and not using tablespoon or teaspoons. So that information is available to the public as well.
So patients and families should know what medications they're taking and maybe keep a list with them that has all the information about their medications on it?
Absolutely. I highly encourage anyone. I have, a phone, a smartphone, and I keep a lot of my medical information in there, including an updated medication list. And we encourage people to bring a list with them. Sometimes even bringing the bottles is helpful. If there are multiple bottles, even just taking a picture. So when you get to the doctor's office or you get to the pharmacy or even admitted into the hospital, your caregivers can see the information. Obviously you want to keep that personal, so we encourage, a password protected on your phone if you're keeping that information. But it is very critical that we do med rec properly, and the patient's always the source of truth. So the patient or the caregiver, the one administering the medication, we always want to make sure we have a good, robust interviewing process with them to know what they're really taking.
And I actually find that our pharmacy team tends to do the best job with that, because they look into all the details of what the patient tells us they're actually taking, but also calls pharmacies and it can take a while to do a good med rec.
It can, and I'm really glad that you mentioned that, because we feel like pharmacists are the true medication experts in this area, and we want to partner with our providers and our nurses, that you're doing other things when you're taking care of a patient versus the pharmacist can really focus on just those medications. And many times we find patients too will divulge information to us as pharmacists that they don't always think about with other healthcare providers. I've spent 7 years in a pediatric intensive care unit, and I've had many times where patients or parents have told me things, and my medical team comes back to me and said, well, how did you know that? And it's just, it's a conversation that I can have with them, just because we do have that training and we know those questions that we should be asking.
And people should, I think, also just be aware that these transitions, when somebody is admitted to the hospital, when they're sent home from the hospital or sent home from some sort of nursing home or whatever, those are real, should send some red flags up about, to make certain that you're taking exactly what your provider wants you to be taking.
Absolutely. We want to make sure that through those whole transitions of care, that every step of the way. And patients should really feel like they can always speak up. We have that culture of, that safety, that the patients need to be their own advocates. They need to ask us questions, that we don't always necessarily know everything. We have resources to help us, but we want to make sure we're partnering with those patients, that they're asking good questions. Maybe when they've been in the hospital and they go home, that's a good point there for follow-up and really talking to your healthcare providers, or going back to your doctor for a visit. Each one of those points, we want to make sure that we know exactly what they're taking and if they have questions.
Well, thank you so much for your contributions to patient safety. Your organization, I think, is a leader in helping make care better for patients, and we so much appreciate your time this afternoon.
Thank you.